Welcome. This module will help you better understand resistance training in the water. This module will get your feet wet in the world of aquatic physical therapy. Here, we will learn how to use water to increase strength and force production. My name is Kat, and I will be co-presenting with my good friend Shannon. We want to give a shout out to our school, Murphy Deming, located in Fishersville, Virginia, in the heart of the Shenandoah Valley. Before we get started, we would like to introduce ourselves. Shannon and I have been friends for the last few years and bond over Starbucks trips, ice cream, and study breaks to get hibachi. It's a miracle we fit into swimsuits for this module. We enjoy hiking and playing with our dogs, Indy and Ollie. Indy in the back is a mini Australian Shepherd, and Ollie in the front is a Bichon Shih Tzu mix. Now that you know who your speakers are, let's jump in.
So here are some objectives for our module. After completing the aquatic resistance training module, the student will be able to define resistance training utilizing water properties, name the components of FIT-VP, discuss methods to progress or regress intensity in an aquatic FIT-VP exercise program, discuss volume and progression in aquatic therapy, identify safety precautions for patients undergoing resistance training in the water. Continuing with our objectives, the student will be able to describe the methods to improve strength by using water in patients of all populations, identify various ways to provide resistance in the water, correctly identify 3 indications for the use of aquatic resistance exercise over traditional land-based exercise, discuss how aquatic therapy can benefit land-based activities, and be able to use pain, fatigue, or change in quality as performance indicators. Here is a little bit of review for you, or at least we hope that this is review. Anyone who is doing resistance training is trying to increase the force production and make the muscle last longer. In order to find someone's starting load on land, we would perform a 6-rep max. Or you can do a 1-rep max or a 10-rep max, depending on your patient's abilities. For this example, we are using a 6-rep max, and then finding what 70% of that max is. You can use an RPE scale in order to get a qualitative measure of how your patient is feeling with exercises. A dyspnea scale can also be used to measure intensity.
FIT-VP, what is it? Hopefully you should know how to create a FIT-VP on land when prescribing exercise for your patients. If not, here's a quick refresher. A FIT-VP is an exercise program which is designed in terms of frequency, intensity, time, type, volume, and progression. FIT-VPs are used to adequately dose a patient with the right amount of exercise according to their individual needs. FIT-VP can also be used for patients in the water, which is what we will continue to discuss. By the end of this module, you will be able to design a FIT-VP for a patient in the water.
PI-FPQ. What is it? PI stands for performance indicators. The 3 indicators are fatigue, pain, and quality. This is the way that physical therapists should monitor their patients both on land and in the water. Observing these indicators will show response to training. For example, a patient is asked to perform 2 sets of 8 reps at a given intensity, and they cannot complete the second set due to pain or decrease in quality. You may need to terminate or modify the exercise. As you can see in this picture, Kat, on your left, is very fatigued and can no longer go on. Jamie, to the right of Kat, is showing decreased quality in her exercise, and she should terminate her activity as well. Niall, who's next to Jamie, is still hanging in there but starting to struggle. But as for me, on your right, I am doing great. You could probably even increase the intensity of my exercise. Disclaimer: Niall and I would not have our aquatic resistance tools out of the water if we were really doing aquatic therapy. We only did this as a way of depicting quality.
Here we have an example of a FIT-VP for force production. Many of these measures can be adjusted to your patient's individual needs. Here we have a frequency of 2 to 3 times per week. The intensity is set at least 70% of a 6-rep max done on land, which we learned about a few slides ago. We are going to take at least 1-minute rests between doing resistance training in the water. In the picture, you can see Shannon completing shoulder adduction using buoyancy resistance of the blue dumbbells. Her volume is going to be 2 sets of 8 to 12 reps based on the ACSM guidelines. To progress this Fit VP, we will increase the intensity by no more than 1%, so 71% next week, or progress to 3 sets of 8 to 12 reps. There are a variety of ways in which you can progress the Fit VP. You want to pick the progression that is most challenging and appropriate for your patient. Always be sure to monitor your patient for changes in pain, fatigue, or quality of movement throughout their exercise. Here we have another example. Similar to resistance training, we can create a Fit VP for muscle endurance. Again, we have set the frequency to 2 to 3 times a week, but we will be doing a less intense workout for more repetitions for the same amount of time. When we progress, we will increase the intensity or the amount of reps. As always, be sure to monitor your patient for changes in pain, fatigue, or quality of movement. Here is an example of an endurance exercise in the water. I am doing tricep pushdowns with dumbbells in the water using water as resistance. The picture on the right demonstrates the effect of physical stress on tissue adaptation. If we are overloading the body too much, it can lead to injury or death. If we do not place the body under enough stress, you will lose tolerance and your muscles will atrophy. Increased tolerance to exercise comes from the right amount of physical activity. We can adapt the level of physical activity using intensity. We cannot make gains if we do not overload the muscle.
We're going to shift gears here a little bit and discuss intensity. On land, we would use percentages of max rep in order to grade intensity. But how do we translate that intensity into the water? Intensity in the water can be altered with cadence of the movement, drag force of the object being used, length of the lever arm, hydrodynamic position, and number of repetitions. Continuing our discussion of intensity in the water, here are some definitions from the previous slide. Cadence is defined by a given number of reps in a set amount of time. This can be measured and maintained with a metronome, which you can download onto your phones, and it's super convenient. Drag force is the force of resistance being provided by the training instrument. Drag force can be increased by increasing surface area of the instrument or increasing the pace per minute. Lever arm is defined as the length from the fulcrum to the line of action. For example, in shoulder flexion with elbow extended, the lever arm is going to be the length from the hand to the shoulder. Level of submersion also alters intensity. The more you are submerged, the less gravity works against you. This makes it easier to do things such as stairs, sit to stand, and squats. This can be a little tricky because if you want to load the legs more, you would have to put your patient in more shallow water. Here are some examples of ways that you can increase the intensity of the workout in the water. Increase surface area of your resistance training instrument. Here you can see Kat doing upper extremity abduction exercises with the blue paddle. She can increase the intensity by closing the fan on the paddle, which increases the surface area. You can also increase intensity by increasing the cadence of your movements. For example, increase the number of reps in a set amount of time. Buoyancy is not just for floating around on the lazy river. We can also use it to assist with our strengthening program. In this next video, you can see Kat performing tricep pushdowns with different sized styrofoam dumbbells. When she uses the smaller ones, it is easier for her to pull them under the water than it is when she uses the larger ones. We can also use buoyancy of the styrofoam to do eccentric work. In this video, the styrofoam is trying to pull Jamie's arms into abduction. However, if we instruct her to bring her arms up in a slow and controlled motion, she is able to get an eccentric contraction. Lastly, level of submersion. As I said in the last slide, we would increase submersion to decrease the load on the body. One example of this is heel raises. If your patient is performing heel raises in chest-deep water with ease, and you instruct them to do the same exercise in waist-deep water, he or she may not be able to perform the same movement with the same quality. This is because gravity is going to have more of an effect on them when they are less submerged. In these pictures, I am demonstrating different levels of submersion. In the first image, I am in knee-deep water. Since most of my body is outside of the water, I am less buoyant and gravity has more of an effect on me. This loads my joints more and forces me to do more work. In the next picture, I am in hip-deep water. When compared to the first image, this level of submersion takes some of the load off of my joints, making it so that I don't have to do quite as much work. The third image is of waist-deep water, thus even less load on my lower extremities. The last image is of chest-deep water. This is the level of submersion you would use for someone with extremely weak lower extremities, someone who needs to take advantage of buoyancy in order to offload their legs. Here we have a male patient who we will call Ronald. Ronald is performing squats on the steps of his therapy pool in waist-deep water. As the amount of force that he is able to produce increases, Ronald will gradually move up the steps to perform the same exercise with less submersion. Having more of his body out of the pool will increase the intensity of his exercise by increasing the load on his lower extremities throughout the squat motion. Here are some examples of various tools that can be used to provide resistance in the pool. You can use fans, as Kat demonstrated in a previous slide. Also, dumbbells can be used, as demonstrated by both Jamie and Kat in previous videos. Stairs can be utilized in aquatic resistance training. This is where level of submersion really comes into play. Ankle weights can be used to increase resistance in the water. One thing to keep in mind is that some of your patients may not be strong enough to use some of these. In this case, their bodies can be used to provide the resistance that they need for their exercises. Here is an example of Kat using only her body and the water to create resistance while doing upper extremity exercises.
Let's go back to the Fit VP we created before and discuss volume and progression. We have a frequency of 3 to 4 times a week and an intensity of at least 80% of their 6-rep max. We are going to continue to rest for 1 minute between sets while performing resistance training exercises. We will do 2 to 3 sets of 8 to 12 reps. We will increase the progression by increasing any of the parameters I just discussed. However, to make exercise more difficult, we will perform the exercise in different depths of water. For lower extremity exercises, if we go into more shallow water, the force of gravity is placing more weight on the body. We increase load by decreasing depth of water. First and foremost, if your patient is uncomfortable with water, do not force them to do aquatic therapy. The therapist must ensure that transfers in and out of the pool are safe. This includes stairs and using the chairlift. Make sure that your patient is in the correct depth of water and be sure that flotation devices are in place for proper positioning and safety. Any patient with open wounds should not enter the pool for risk of contamination and infection. Finally, follow the rules and regulations of the pool you are treating in.
It is important to keep in mind that with aquatic exercise, our ultimate goal is to improve land-based function. We want to use the water to assist with increasing force production and increasing muscular endurance. Once we accomplish this, these improvements should be able to transfer into land-based activities and thus improve our patients' quality of life. As you can see in these images, the quality of life around our therapy pool is pretty high. So why do we perform resistance training in the water? Some patients may prefer water exercise over land exercise. Some patients may have weakness, for example, manual muscle test grade of 2 to 3 out of 5, and they need to use the property of buoyancy to help them move better. Some patients may be extremely weak, manual muscle test grade of 1 to 2 out of 5, and being in a horizontal position in the water may help them to be able to move against resistance with manual cues. If this confuses you, hang tight, we've got an example coming soon. Water provides resistance in all planes of motion and allows for easy transfers. Water also provides resistance for eccentric motions that cannot be performed on land. Water can change the effects that gravity has on the body by altering the patient's level of submersion. For joints that are injured, the pressure of the water provides compression on the joint, thus helping to decrease edema and improve blood circulation. Lastly, water exercise is often less painful than land-based exercise, which kind of relates us back to the first example as to why patients may prefer it.
Case study number 1. We have a 31-year-old female diagnosed with Guillain-Barré, and she presents to physical therapy extremely weak in both the upper and lower extremities. We manually muscle tested all her muscles, and she was consistently a 2. She could only move slightly through her range of motion in gravity-eliminated positions. She would like to increase her strength to return to her activities of daily living, such as brushing her hair and preparing her meals. Think a little about this case and what we have learned so far in the module. Hit pause and think about what you could do with her in the water to help improve strength. As Shannon mentioned earlier, we can position our patients in a horizontal position and provide resistance that way. The therapist has set up the patient so that the patient is supported by flotation devices under her knees, pelvis, and neck. The patient is doing no work to float in the water. As the patient floats, the therapist is providing resistance to the lateral side of the patient's arm and asking the patient to push off against her into abduction. When the patient has achieved that motion, the therapist moves her hand to the medial side of the patient's arm and asks the patient to pull her arm against her into adduction. This is a great example of an exercise to do with a very weak patient in the water to improve upper extremity strengthening. Here's another example of an exercise to perform with this patient in the water in order to improve lower extremity strength. The patient is floating with the same amount of flotation as the last slide. The patient is positioned so that they are in the squat position at the edge of the water. The therapist pushes the patient into the squat position and asks the patient to push off of the wall. The therapist then catches the patient and repositions them again for a subsequent repetition. Here's a video demonstrating the last slide. A 3-year-old female with cerebral palsy comes to Aquatic physical therapy. She presents with decreased ability to stand independently against gravity on land. You think that she might be able to perform standing in the water. How do you do this? Think about this for a minute and think of ways that you would be able to help a 3-year-old stand in the water. When you're ready, continue to the next slide. So hopefully you thought to use the stairs or positioning the child so that they are at varying depths of submersion. This little girl would not be able to stand even in the shallowest end of the pool. To make standing the easiest, we would use the bottom step of the stairs or have her at chest-deep water. We would make this exercise harder by putting her on higher steps or having her stand in hip-deep water so that the effects of gravity would make it harder for her and improve her ability to stand. Differing immersions in the pool serve as a great option for exercise to use in the pool to improve standing. The little boy in the left picture was unable to stand on land, but here you can see him standing in the water. As we've seen before, here's an example of the varying depths of submersion to make exercises easier or more difficult as you progress your patients. Case study number 3. Ronald comes in for physical therapy with complaints of osteoarthritis in both knees. He has difficulty walking because of the pain, yet would like to continue to be active. His BMI is 30.7, and he knows that the weight is contributing to his knee pain. Take a minute and create a Fit VP for Ron. Alright, so hopefully you came up with an exercise and a Fit VP. I decided on water squats in order to keep him active while decreasing the weight on his joints. We will have a frequency of 2 to 3 times per week, giving him at least a day in between to rest. His intensity will be defined as his level of submersion. We will start him out with squatting in hip-deep water, and we will gradually increase the intensity by having him squat in shallower water. He would take 1-minute rests between 3 sets of 12 reps. He is performing resistance training, and to progress his Fit VP, he is going to increase his number of sets to 4 for the next week. Again, we are always looking for pi FPQ, monitoring him for changes in pain, fatigue, or quality of movement. Case study number 4. A 44-year-old male comes to physical therapy for shoulder impingement. His pain is keeping him from participating in baseball. He would like to return as quickly as possible, but he cannot lift any weight on land without pain. What do you suggest? Well, by this point, I hope you told him about aquatic physical therapy and how the water can take the force off of his shoulder joint. You could improve passive shoulder range of motion while the patient is supine in the water. You could also have the patient complete shoulder strengthening exercises, such as flexion and abduction, both concentrically and eccentrically, while using the resistance of the water. Once he begins to improve, you can progress to the blue paddles and eventually the water dumbbells. In our last case study, we had the patient perform shoulder strengthening exercises in the water. What do we do when those become too easy? Can physically fit patients benefit from aquatic physical therapy? The answer is yes. In a study by Collado et al., they found that they could control intensity in the water through joint control of the pace of movement, a number of repetitions that aligned with current recommendations for controlling training against resistance. This study used 20 young, healthy, physically fit men and found that performing resistance training exercises in the water using a metronome was effective in increasing strength in 8 weeks. Aquatic therapy is not just for the weak, deconditioned patient. It can be used for any population, even healthy, strong individuals. The study that we just discussed used a metronome to control the pace of movement in the water. Shannon explained a metronome in previous slides. This video shows a speaker set up to project the pace of the metronome so that patients in the water can match their pace. The video on the left is a metronome set to 60 beats per minute. This would be a good starting point for a patient to match their reps in the water. The video on the right is 120 beats per minute. This pace would progress the intensity of the exercise by doing more reps in the same amount of time. As Shannon stated before, this is an increase in cadence.
Thanks for completing the aquatic resistance training module. For more information, check out these references. If you haven't yet, go listen to the aquatic cardiovascular training module that was made by our classmates and good friends. Thanks for tuning in.